The chair lays out House Bill 3749 and recognizes its sponsor, Senator Campbell, to explain the bill. Welcome, Senator Campbell.
Good morning, Madam Chair and members.
Thank you. Welcome. Pull that microphone a little closer.
I sure will.
That middle microphone. There you go.
There we go.
Speak loud.
Loud and proud. Okay.
There you go.
Well, first of all, I'm very pleased to sponsor House Bill 3749 by Representative Orr, Oliverson.
Hey, Senator, before I allow you to go,
Sure.
Senator Miles has been here for a while, and I had not recognized him as being present, and I'm sorry about that, Senator Miles. We were intensely listening. Senator Miles has been with us for quite some time this morning and present.
And watched it.
Senator Campbell, you are recognized.
So I am very pleased to bring this bill forward with the representatives that have co-authored this bill. This bill, there's a story. Most of our legislation is, but this bill is in response to the tragic death of Jennifer Cleveland, her husband you will meet later, who was killed after she was given an elective IV therapy by someone who was not a medical professional acting under the delegated authority of a physician. House Bill 3749 restricts physician delegation for elective IV therapies to only registered nurses, APRNs, and PAs. Now, there will be others claiming that they have the talents, that they should be included on the list to be able to give elective IV therapies. However, in keeping with the intent of the author, who spent a lot of time with stakeholders and crafted a very thorough and thoughtfully written piece of legislation, I will not expand the scope of this bill outside of RNs, APRNs, and PAs. Elective IV infusions, this is becoming a cottage industry. It's a hydration industry, if you will, and it's happening at med spas, mobile IV bars, hydration clinics. I've even heard of the garage door opening, beach chairs are in the garage for people to line up, pay their money, and get IV therapy. This bill is a safety requirement that's needed to provide a clear statutory standard to whom a physician may delegate elective IV administration. We have got to rein in this unregulated or loosely regulated cottage industry that is running wide open to prevent another tragic death. And I use the term wide open because senators like Senator Cook and any nurses or physicians that work around IVs know that you do have to be cautious anytime you leave an IV wide open. The bill passed the House 132-2. Thank you very much. I'm happy to answer any questions.
Dr. Campbell, Senator Campbell.
Either's fine.
Yes. You come with a little expertise in this arena.
Yes.
And so, again, the safety part of this, making sure anytime you put a needle in a vein, there can be all kind of things that happen. Plus, how much of a B12 vitamin you might be administering, et cetera.
You know, and the basic of it is hydration with fluid. But everybody may not be able to take 1,000 cc's, which is the standard liter IV bag. If you've got, for physicians in the ER, Senator Cook, when she's in the ER, she thinks twice. I better think twice, especially if a nurse is thinking twice, about whether to give a liter of normal saline, say to somebody who has a glomerular filtration rate, which Senator Miles would know about that is very low. Can that patient really get rid of any excess fluid? And what if they've got a low cardiac output? That's where your heart can't beat down well enough. You can get an acute pulmonary edema with that. And what do? Are you in a resuscitative area that you can give the medications to try to get that fluid off? And is there an age specific that they're starting with to decide whether to give it or not? It needs to be under physician delegation, and it needs to be looked at really where. Now, this bill doesn't say where it can be given, so there's still med spas and stuff. The bill is focused on who can give it, and that's it.
Okay.
But yes, the additives and the unfortunate thing around this death, Jennifer Cleveland's death, she was given potassium. Yeah, like a vial of potassium. Died. It'll put you in fibrillation, where the heart is just quivering. It can't beat down. And you can get a defibrillator and defib them, but they go right back into it. It's an acute process. EMS can't get there quick enough and even combat the effects of potassium. So that's somebody not knowing that they don't know until they know they don't know, and a tragic death. And we've got to prevent that.
Thank you, Senator Campbell. We have 5 wishing to testify. I'm going to call up Rain Coddington, Dora Ittenberg, Ezekiel Zeke Silva, Terry Zunker, and Brian Cleveland. And Senator, if you'll just sit right here, you can join us, or sit where Senator Sparks was, either place.
I'll sit where I'll be Senator Blanco for a few minutes.
Okay, that's great. Yes, you may. We have 5 seats. 5 seats.
Good morning.
Good morning. Just a minute. I have no one else wishing to testify on House Bill 3749. If you wish to testify, you are not registered at this point. Okay, what we'll do is we'll start right here. And Dr. Silva, if you'll join us over here. We'll start with you two, and then we'll go around the table. If you would state your name for the record, who you're with. No, we'll start with you. Rain Cottingham, or right here. You, yes. If you will state your name for the record, who you're with, your position on the bill, and you may begin.
My name is Dora Eatonberg. I'm a licensed paramedic in the state of Texas, and I am here to speak on House Bill 3749. I represent paramedics across the state who serve not only in emergency response, but also in preventative health and wellness care in the growing field of alternative wellness. Providing mobile IV hydration, vitamin therapy, and in-home support under physician supervision. I want to be absolutely clear. We fully support the intent of HB 3749. Protecting patients from unqualified, unsupervised care is necessary, and a responsibility we all share. What happened to Jennifer was heartbreaking. No patient should ever be placed in the hands of someone without proper training, licensure, or oversight. As a paramedic, I carry that truth with me every day. We mourn her loss, and we stand with her family in calling for stronger safeguards, 100%. We believe HB 3749 can be made stronger by ensuring it protects patients without excluding the very professionals who were likely called to try and save her life, paramedics. Licensed paramedics are often the first on scene in emergencies. It's difficult to imagine the same providers trusted in critical moments would be excluded from delivering fluids and vitamins, especially under physician supervision and protocols. We are not rogue actors. We are licensed, supervised professionals with over 1,400 hours of clinical training operating under Occupation Code 157. We're not asking to act independently, just to continue providing the care we already trained and authorized to deliver safely and legally. And if this bill is not amended, it puts hundreds, if not thousands, of paramedics at risk of losing their jobs, many of whom have transitioned into non-emergency physician-led roles. These are livelihoods built on safe, supervised care that Texans rely on every day. We respectfully and strongly request that you amend HB 3749 to include licensed and certified paramedics under appropriate physician delegation. The simple fix doesn't expand our scope. It protects patient access and strengthens the bill. With this amendment, HB 3749 can truly honor.
Thank you. If you would state your name for the record, who you're with, your position on the bill, and you may begin.
Rain Coddington. I'm a certified paramedic and CEO of IV Texas, and I'm testifying on the bill.
Okay, great.
Thank you for the opportunity to speak on House Bill 3749. I'm here to voice strong support for an amendment. As written, this bill would prohibit paramedics from performing elective IV therapy, care we've been safely providing for years under medical supervision in the state of Texas. We hold ourselves to high standards with patient safety in mind. Since 2018, elective IV therapy has been performed in Texas more than 50,000 times by paramedics, with 0 reported adverse events occurring. Paramedics are advanced providers trained to start IVs, give critical medications, interpret EKGs, and manage life-threatening emergencies like stroke, sepsis, and cardiac arrest. They perform rapid sequence intubation using sedatives and paralytics to secure airways. If paramedics can safely manage high-acuity patients with an advanced scope of practice, then why would they be barred from administering low-risk IV fluids and medications under adequate physician supervision? In Fort Worth, MedStar's Mobile Integrated Health Program, an out-of-hospital system which other Texas agencies have mirrored, paramedics are trusted to treat and release patients safely in their homes every day. They start IV medications, perform detailed physical exams, and carry out physician-led care plans, often preventing the need for ER transport altogether. This bill was sparked by Jennifer's tragic death involving an unlicensed individual administering an extremely high-risk medication. However, paramedics weren't the problem. They were the ones called to attempt to save her life. If this bill passes without amendment, it would put hundreds of paramedics out of work in the state of Texas and restrict patients' access to care from competent providers with well-established relationships. We respectfully ask for an amendment to allow paramedics to continue practicing under adequate physician supervision. It's the right thing for patient safety, access to care, and our healthcare workforce. Thank you.
I have a quick question. So it's elective intravenous therapy. So you're not saying when you're on the job.
So my understanding is this bill would only apply to paramedics operating not under an agency EMS license.
Correct.
So the example of how this applies to every day as it would fall outside of this bill, speaking on MedStar and their community mobile integrated health system, that would not be affected by this bill, but that's just to prove that these things are being done safely under an EMS licensure because we're operating under the Code 157 outside of the EMS licensure,
So basically,
under the physician.
It's being provided by Community Paramedicine. If you've ever heard of Community Paramedicine, we go into people's homes, we treat them, we give them medication, and we release them per the protocols, which is what we do in a different
Who orders that? I mean, is that?
physician.
It's both online medical direction and
standing
protocol
orders.
given,
Yeah,
or protocol driven. So,
standing and
lab says this, adjust patient's medication to this, and it's used in a variety of different functions for different high-risk populations.
which by doing that, they've saved thousands and thousands of dollars because these people that just need hydration or anything like that, instead of going to the hospitals and the ERs, they're getting that treatment at home.
Senator Perry and then Senator Campbell.
So you're not the concierge, I don't feel well today, I'm gonna pick up a phone, I just saw the ad on TV, I'm gonna come out and help you. That's not y'all.
Wait,
Yes, sir,
that-
we are doing this. So
We are.
what-
yeah.
Oh, okay.
So what we're talking about with community paramedicine is how paramedics are doing this.
I don't wanna confuse the subject matter. There's been a cottage industry that's developed. I personally have not, but actually my wife did it one time. Gave me a little heebie-jeebies because they're literally coming out and putting something. She felt great afterwards. It was kind of a flu type deal. But that's what the industry is that's created this niche market that has created, unfortunately, the worst of the worst things. So you're pitching two different subject matter here. You're presenting that we are getting an order from a physician to go out and deliver under physician orders, what I just heard you say. But if Charles Perry called you up today and said, my wife's not feeling all right, I don't feel well, can you come over and give me an IV of B12? Without going through a physician, y'all would do that too?
We have something called good faith exams. Those are put in place. So that is in the state of Texas. So,
Don't confuse it. Is there a doctor oversight of you
Yes,
intervening?
100%.
And so
We have signatures. I also have that to
you
provide.
you don't get a call and go on your own accord. So if you don't know my doctor, you don't know my deal, who puts the doctor in touch with me to engage you?
So upon booking, there's an in-between between us dispatching a provider, sending a provider to you. There's a telehealth exam either done via Zoom-type fashion or over the phone with the provider.
Yeah. So, Madam Chair, this is exactly the industry that's created the problem. Don't buy what they're selling.
Dr. Campbell?
Go ahead. Is your
Well, I was just going to say, that was going to be my question. So a lot of telehealth doctors that are ordering that, are they in-state or out-of-state? Do we know?
It's a mixture, and if I can submit these to y'all, this is all of the.
Actually, Brett, is Brett back there? Yeah,
I
or
apologize, I should've
somebody, if
done
you
that
could just
first.
give it to him, that'd be super, or one of the, thank you.
We personally have an in-state doc and in-state NP that does the majority. We do have a third service, telehealth service, that will help with overflow at poor times.
I want to be very respectful, but what I think I'm hearing is that we have mobile med spas traveling around the state of Texas. And I mean, I'm always amazed in this committee what we discover. So I'm just saying, I think one of my staffers said that there are retired paramedics, many of which do this as well. Is that correct?
Yes,
So I am not a retired paramedic.
I know you're not retired. You're too young to be retired. If you're retired, we have a problem. We need trained professionals staying in the profession. That's why we have a shortage of doctors. We need them like carrying 40 and 60 hours a week, Dr. Silva. I'm on to this too. Dr. Campbell, you need to work as hard as Dr. Campbell. Dr. Campbell.
Thank you, Madam Chair. Do you have an independent liability policy
Yes,
Yes, ma'am.
with your name or your company?
yes.
There's an umbrella
Are
policy.
you, do you two have the same company?
I'm sorry, no. I
Okay,
thought you were
I'm
talking
sorry.
to
I
me.
was looking at him specifically.
Yes, ma'am.
So you have your own liability policy, separate from work or anything else. It's something you pay for, is that correct?
And the umbrella policy covering the PLLC.
The LLC. So the LLC is, if something goes wrong, a customer, I'm gonna call them a customer rather than a patient, they can get a judgment, not against you personally, but against an entity that is set up for the purpose of shielding. That's what an LLC does, shielding your personal self from liability. Who is your CMO?
CMO, Dr. Kotri.
And Kotrick is,
He's an ER physician.
okay. How does he get paid?
So the money flows through the physician's account to be in compliance with CPOM, and then
Okay, so,
then the customer-facing company basically receives a portion for the services with marketing and basically operations of the.
so IV Texas charges a person credit card, cash, either.
Usually credit card,
Insurance does not pay for it.
not at this moment. Some facilities do.
So insurance
clinic.
doesn't pay for it. The money goes to your CMO, a doctor.
Yes, ma'am.
The doctor then pays IV Texas. So it's flowing through, and so the limited liability, your LLC covers, does the doctor get covered under that LLC?
I believe
limited
he's covered
indemnity?
under that and his own malpractice
And his
insurance,
own
as well as my
malpractice.
understanding.
It has you have no coverage from your regular job work if you still do paramedic
Yes, ma'am.
job. Is that correct?
Correct.
Your paramedic job, do you still do paramedic?
I work in the ER
Okay.
part-time. Yes, ma'am.
So it does not cover anything you do because what you do is a personal interest business,
My
correct?
understanding is that policy would only cover me while working at
Yeah, working in
ER
the ER.
under.
And that's where you're trained, and that's where your specialty is. So when you come to the rescue, which you do, the EMS is invaluable. They're trained in emergency. They've got clinical hours. They don't have college diploma or degree specifically in paramedics,
I do.
you?
Yes, I'm
Is
a
it in
licensed paramedic.
Well, I know you're a licensed paramedic, but you
Well,
can
you have
get
to have
that
a
with
degree.
steps.
I
Do you have a
degree in it.
bachelor's degree
An
that says
associate's.
of nursing?
Not of nursing, of paramedicine.
Okay, so
Yes.
a 4-year of
2 years of
medicine.
associates.
2-year, okay, all right. But what you're trained in is emergency situations. But you're not trained, and you said
I
that.
disagree with that statement.
Okay, first of all, I'm going to ask the questions. That's okay. But when do paramedics get the non-emergent wellness education? you, if you would, and I'm sorry, I don't know your name.
My name is Dory.
All right, Dory, when do you get that in your academia?
So we get, if we were speaking specifically in academia, we are in the ER, we are in different
No,
floors
no,
of
no,
the
I'm
ER.
talking about classroom, where do you get the wellness
Pharmacology,
education?
cardiology, nothing is emergency in the classroom. Everything is basics.
Okay,
It's like what did I say,
that's
1,400
okay.
hours of
I think-
clinical
got
studies?
it. Yeah, I understand the clinical and the steps going from a basic to an EMT all the way up to paramedic.
A few of them, yeah.
So I know you've got an independent liability policy. I know you have a CMO. And how much does he get paid, he or she?
It's a percentage.
What percentage?
It's 10%.
They get 10% of whatever is brought in. Okay. And you already answered that you do offer IV to people that you don't know. Do they get a select from a menu of options to what to put in the IV?
They're cleared by a provider.
But is there a menu of options
Yes,
to
ma'am.
choose from? Thank you.
But they're cleared for
Are
any of the
you,
options.
and you're self-employed except in IV Texas is a business.
Yes, ma'am.
So you're self-employed there. If a person has a problem, who do they file their complaint with?
I don't know the answer to that question
So let me get this
specifically, but-
straight, sir. Let me get this straight. You've got a business shielded by an LLC offering IVs where there's a telemedicine. The doctor, your CMO, actually talks to the person getting the IV. Is that correct? Every time?
Either him or one of the telehealth services that we contract with provide
Telehealth
third-party
services.
Yes,
Who
ma'am.
does the physical exam or the
It's we
H&P?
use a company called Dalcovia as a kind of in between.
All right, so you have a service that you contract with that makes contact with a patient. But if there's a problem, they don't know who to call.
I believe it would be the Texas Medical
But
Board.
this is your business. You should know, and patients should know. I call them patients, sorry. Customer, because that's how they're treated.
Yes, ma'am.
But you can't call them really a patient because you weren't called by a doctor to go out unless you are called by a physician to go out and give a certain medication or something. So your business is a non-emergent business, and you've set it up, made sure that you're indemnified by your LLC, but a customer receiving an IV, if Senator Perry's wife got an IV and got phlebitis or something else, you don't know who they would call?
911.
Okay, for a
Right.
phlebitis?
They would.
So you don't, you said 911 and shrugged your
If they're
shoulders.
having emergency
This is
situation,
not-
we call
well,
911, right?
Would you say that phlebitis is an emergency?
Not necessarily, no.
No, not necessarily. Now, if you end up with an embolus, that's a different story, but I'm directing to him because do you have your own independent business also?
We do.
You do, okay. So this
All
definitely,
do. Up
okay,
here.
so this bill definitely affects your business. So you're here protecting that business, and you've got a business, and you don't even have a number to tell somebody who to call if you have a problem? I think that's just my
Their
opinion, I
complaint
think
is
that's a little,
It would be the Texas.
sir, okay, you,
So Dr. Campbell, we're going to wind
you're
this
talking
down.
to me,
You've
I'm
made your
sorry.
points, I think.
okay. Then let me not, I'm not gonna, I think you've answered things enough. Thank you very much.
Thank
And
you.
I think that, especially with the questions that Senator Perry asked and that you made a comment on, I think it just shows it's something we've got to rein in.
Well, and we're going to hear from our other witnesses. We've been up here discussing, I get it now. I mean, and I'm going to say something that there has been a practice like, let's just say, maybe if you're having a wedding weekend and the brides and grooms are maybe at the rehearsal dinner partaking of libations, you might the next day want to have them hydrated for the wedding that evening, and you call these IVs in. And I wasn't sure all this was going on. I don't know what rock I live under, but I'm not getting IVs for hangovers. So I kind of understand the business now. I've been informed by the young people up here that what's going on. So we're going to just keep going around the table. I'll go to Dr. Silva, and then we'll go to the...
And Madam Chair, I'm going to excuse myself. Thank you so much for allowing me to.
Thank you. I know you're going to Senate Finance. I have 2 bills in Senate Finance that I believe Senator Hinojosa is laying
Gonna
out
lay
for
out.
me. Thank you.
I'll check on that for you.
Thank you very much.
Yes, ma'am. Thank you.
Dr. Silva, I'm on a roll. You have testified 2 days in a row. This is 3 in a row? 3 in a row that you're for a bill in Senate Health and Human Services, so I feel like we're on a roll together. If you would, state your name for the record, who you're with, and your position on the bill, and you may begin.
Thank you. Yeah, Zeke Silva, physician, San Antonio, Chair TMA Council on Legislation. I am speaking on behalf of the TMA, and I am speaking in support of House Bill 3749. I do want to thank and acknowledge Senator Dr. Campbell for sponsoring this bill in the Senate, but I also do want to acknowledge Representative Chair Orr in the House for bringing this bill forward. The story that you are going to hear about Jennifer Cleveland shortly from her family was one of her constituents. So this is a particularly relevant, personal, and meaningful challenge for her to address. We've had a few discussions about the climate. I don't need to repeat hydration bars, hangover relief, and all of that, or even things that potentially have therapeutic value. But as a physician, I would like to speak to the medical aspect of what we're discussing. Placing an IV, infusing a medication into the bloodstream is a medical act, as defined by the Medical Practice Act. Physicians under state law have the ability to do that. The only time another professional, non-physician, has that ability is if we delegate and supervise that responsibility. The individual professionals to whom we can delegate that are APRNs, physician assistants, and under a higher level of supervision, potentially registered nurses. That's it. That list does not include paramedics. It does not include licensed vocational nurses. It does not include phlebotomists. That key critical piece is essential to this discussion. All we're trying to do is unify this effort with existing state law with the broader goal of protecting patients, understanding this industry in a way that these professionals have proper supervision so that patient safety is maintained. And so the story that you're about to hear, and I just want to say I've had the honor of getting to know Jennifer Cleveland's family during these discussions, and the story you're about to hear, we just want to make sure that that is not repeated. The TMA is committed to that goal. Madam Chair, members, thank you.
Thank you. I'll Terry Zunker, and then Mr. Cleveland will end with you. Ms. Zunker.
Good morning. My name is Terry Zunker. I'm here today. I'm going to try to make it through this. I'm sorry. Y'all just bear with me. With my brother, Brian Cleveland, to speak on behalf of my sister-in-law, Jennifer, and in support of House Bill 3749. Thank you for allowing my family and me the time to address all of you on this very important topic. I would just like to tell you a little bit about Jennifer. She was a loving wife, mother, daughter, grandmother, and friend. Jennifer's death has left a void in the lives of all that knew and loved her. She was the light of her family. Her children miss her, her love, her guidance, and just her presence in their day-to-day lives. Her granddaughter will only know her through memories of others. Our loss has been devastating and is even more difficult knowing that this tragedy could have easily been prevented had the facility been properly staffed with licensed personnel, had there been proper oversight in the ordering and administration of medication. We would have Jennifer here with us today. And that's why this House bill and Jennifer's law is so important to everyone, so that no one else, no other family will have to experience a tragedy of this magnitude. Thank you all.
Thank you. Thank you for being here today. Mr. Cleveland, I'm going to ask you to scoot way forward on that, and that microphone moves. So if you can speak into that microphone.
Yes, ma'am. Can you hear me?
Yes, sir.
Excuse me. My name's Stephen Brian Cleveland, and I thank y'all for allowing me to be here today to speak to y'all on behalf of Jennifer. She was my wife, and on July the 10th of 2023, she walked into a med spa and she did not walk out of it. I'm not as adequate as a lot of these people in here, and you're going to have to forgive me. But unqualified, unsupervised individual administered an IV to her, and it killed her on that day. And I don't have a whole lot to say, and I'm not going to keep y'all very long, but I will say that one was too many. I've asked that question to a couple of different people, is how many people is it going to take before we decide to do something? And I'm here today to tell you that one was too many. It's been almost 2 years, and I still miss her. I still talk to her every day. And she didn't have to die that day. I'd like to thank Representative Orr and Senator Campbell. The family's truly grateful. And on behalf of Jennifer's family, we're here to ask y'all to prevent this from happening to another family, because one was too many. And thank you for your time.
We're so sorry for your loss. We're just, we'll pray for your hurt, and we'll do our very best to make this right. Thank y'all. Members, that's all we have to testify on House Bill 3749. With that, we'll close public testimony and we'll leave this bill pending at this time. Without objection, members, we have a number of people that have already signed up to witness on the bills that are before us today. Without objection, it's the chair's intent to now close public testimony for all the bills presented. Is there objection to that motion? Hearing none, it is so ordered. The chair lays out House Bill 3940 and